What conditions does a urogynecologist treat?
So, a urogynecologist is the overlap between gynecology and urology, which is important to know that even though it contains components of both, we don't do normal urology or normal gynecology. We focus on issues such as prolapse from the vagina, uterovaginal prolapse, and urinary incontinence, also fecal incontinence.
Okay. So what symptoms would someone be having to come to see you?
The symptoms vary, and oftentimes it's important for, everyone to know that a lot of people feel embarrassed to bring this up, but it is really important to bring up because there's so much that we can do for it. So sometimes when people have prolapse, what they feel first is a bulge coming out of the vagina. Some people can be scared when they first notice it because they think it's a mass or some sort of tumor or something, but it's really just a hernia. So a bulge coming out of the vagina. And then from the incontinence perspective, it's when people notice that they're leaking urine, and that can happen for a few different reasons.
Okay. So can you tell me what those reasons are?
Yeah, there's typically two types of incontinence that we deal with, and the only reason we differentiate is because the treatments are slightly different. The first kind, which is very common after childbirth and with aging, is called stress urinary incontinence, and that's when people leak when they cough and laugh and sneeze. I think that type of leakage, particularly, I've heard a lot of people say they think it's just normal and that they have to deal with it. But there's plenty that we can do to help with that. And then the second kind is called urgency incontinence. And that's when people have the urge to go to the bathroom and can't make it in time. And that's typically related to overactive bladder, which is something I think a lot of people have heard about.
So for the urinary incontinence, what are some of the things you can do?
So it depends on which kind you have. The type with coughing and laughing and sneezing, that's a mechanical problem, and it's usually because there's a lack of support in the vagina. Pelvic floor physical therapy is a great field that we work very closely with. And that type of physical therapy can actually, it's the one treatment that can help with both types of incontinence because strengthening the muscles and improving how they function can really help how the bladder functions. So that's one option for both. For the stress incontinence specifically, providing more support in the vagina can make a difference. So I could fit people with incontinence pessaries in the office. There's over-the-counter options, or we can do a procedure if people want something that's a more long-term fix. We can do either periurethral bulking or something called a midurethral sling. And then from the overactive bladder side, the urgency incontinence, again, pelvic floor physical therapy is a great option, very low risk. Beyond that, there's several medications we can try, and then there's procedures for that too that we can do. For people who have tried other things and that doesn't work, we can inject Botox into the bladder to help with that, or we can even do a bladder pacemaker.
Wow. Okay. So you mentioned some women having problems after pregnancy. How common is that women have issues with their pelvic health after pregnancy?
It's very common, especially after vaginal delivery. Even when someone doesn't have external tears, there's a lot of damage that can be done to muscles of the pelvic floor internally. And those are the muscles that usually have an impact on things like urinary incontinence. So it's not uncommon immediately after pregnancy for people to have problems like this. But then, especially as we age, when we start to lose estrogen in that area, those muscles become even weaker and have less an ability to overcompensate for the damage that had been done during childbirth. So it's not uncommon for people to start coming in to see us after menopause when they start noticing these symptoms more.
Oh. Okay. So is there, if a woman isn't having any of these symptoms, is there something they can do to hopefully prevent them?
Um, yes, I'll say that with a caveat that there's nothing 100%. So if you start developing the symptoms, it doesn't mean you've done something wrong. But seeing a pelvic floor physical therapist, especially around birth, can make a huge difference. But just in general, the exercises that you can do for your pelvic floor, which is a lot of core exercises, can help to prevent these symptoms from occurring or getting worse.
That's great. Thank you so much. This is such an important topic that isn't talked about. So I thank you for talking to me.
Of course.